cannot hold that up. Let's see what happens after I do a treatment on that. All right, now let's see if she can hold her leg up now. Push straight up. Well, look at that. All right, so we're going to do our adjustment. I'm going to start with your feet and adjust everything. So this is an actual adjustment I'm doing on an actual patient. We want to make sure that the base of your body is strong and holding you up properly and that you're balanced. I don't know if you guys can hear all these wonderful pops and cracks that I'm getting here. All right, now we're going to move up to her knees. I'm going to see if that bone here on the outside of her knee needs to be adjusted, and it does. And now I'm going to check her hip and the muscles up of her that are holding her up. Push straight up. She cannot hold that up. Let's see what happens after I do a treatment on that. Okay, this is going to be a little bit tender. And it's just a little bit tender. It's not terrible. And that's tender and icky. All right, now let's see if she can hold her leg up now. Push straight up. Well, look at that. I want that to happen on her other side too. So we've already adjusted her foot and ankle. Let's do this knee. Bend your leg. Good. Now, push this leg up. Take your hand off your body so we're not testing your stomach. We want to test your leg. Push up. And I didn't do that on the other side, but I did get accurate information. Now I do need this up here so that I can get my leg up on the table real quick. Good. And I'm going to rub the side of this leg. And what I'm doing is I'm telling her nervous system, hey, nervous system, when she goes up the steps, this quadricep needs to work. This set of quadriceps. Push up. And now she can hold it up. Fantastic. All right, now I'm going to go ahead and do the neurocranial integration, the neck adjustment, and the neurocranial integration. Since she's a real patient, I can go ahead and do a real adjustment on her. And just drop that shoulder for me. I want my patient really relaxed. I don't want to fight her at all. And now I'm going to do that neurocranial integration. So what's happening here is that the tissue around the brain and spinal cord that becomes the tissue around the spinal cord, and it becomes the tissue around the muscles, the organs, even the cells, it's called fascia. We're reducing tension on that tissue, and that actually affects the entire nervous system and the entire healing of the body. All right, now let's see if there's anything else going on in her body from this angle. Match my pressure. What I'm doing now is saying, hey body, is there anything going on with your hip? Push. No, hip's okay. Hip's okay. What about knee? Is there anything more that needs to happen with the knee or the ankle that I didn't catch before? No, those are okay. I also want to know, how's her stomach? Sometimes people have hiatal hernias or acid reflux that can be handled structurally. So I like to check that on people, and in fact, she does. So what I'm going to do is I'm going to actually work on her stomach so that she doesn't have the acid reflux happen as easily. And this is to tolerance. It looks like it's pretty hard. It can be a little painful. Is this manageable?
I'm fine, yeah.
There we go. And I just felt it kind of come down. So then I'm going to do the rest of that treatment, which means I have to push on the rib heads. This is often the most difficult, the most tender part of it, because when acid reflux occurs, you can end up with some pain in that area. The diaphragm sometimes clamps down around that, and then there's another part that I'm going to do on her back. But let's check and see now. Does her arm stay up or does it go down? Now it stays up. Before it went down because I was testing an area that had some stress, and so her arm went down before, and now push. Now her stomach's happier, essentially, to put it in lay people's terms. So I've adjusted her lower body. I do need to check her sacrum, her spine now. So bend this leg. Now I'm going to use a different muscle. First I want to see if she has a strong hamstring. Well, she doesn't on that side. Push here. She does on this side. So right now I'm going to use this as my indicator muscles to see what needs to be adjusted. Push here. Again, push. Okay, so that sacrum, do you see? Strong muscle. Strong. Nothing wrong there. Push. This needs to be adjusted or something's going on there. So now I got to find out what direction. Push. And that sacrum wants to go that way. So what I'm going to do is I'm going to use this wonderful drop piece on my table to adjust that. Wonderful. Let's see if that's better. Bend, push, nice strong muscle. This side's still okay. Now this side's okay. Cool, huh? Push. All right, push. Now let's see if there's anything else in her spine that needs to be adjusted, and here's something. Okay, so let me go ahead and find out what direction that needs to go in. Okay, all right, now I'm going to adjust this. Breathe in and all the way out. Good. Now let's see if that's better. Bend your leg. Push it nice and tight. Good. Now I'm going to check. Now that I know her spine's in alignment, I'm going to check her scapula on both sides, her shoulder blades, and her collarbones. Bend. Push. The directions, her collarbones, her shoulders. Let's recheck her neck, her skull, etc. That's all okay. Now let me see if that adjustment handled the weak hamstring on this side. Push. And it did. So something that I did along the way here caused this hamstring to know what to do. So it got strong again. And push. Turn it over. Push. Elbow also needs to be adjusted. Relax here. This might be a little bit tender when I do it. Good. And push. Nice and tight. Excellent. All right, let's just do the rest of her hand. Now this particular patient is a massage therapist and a nurse, and she needs these kinds of adjustments. So she's using her hands all the time, and she needs her nervous system to be in top shape. See, it didn't hold before and it does now. Push tight, and that elbow, see when she can't hold it. Push nice and tight, she can't hold it. So I'm going to adjust this. This might be a little tiny bit tender. Let's just relax it completely. Good, and push tight. Let's see if we got it. We did. Good. Oh, that was nice pops. All right, wonderful, wonderful, wonderful. Thank you for coming in, and I appreciate your trust, and I appreciate the work you do in the world. All right, if you have any questions about chiropractic, neurocranial integration, or any of the ways that I work, please comment below. If you know anyone who needs a really thorough chiropractor, I might be their one. So let me know.